Part 13, Punctures and Impaled Objects. Welcome to the lesson on punctures and impaled objects. In this video, we will discuss how to handle cases of punctures and impaled objects. Punctures wounds and impaled objects pose special risk to the injured individuals. Puncture wounds may penetrate deeper than is apparent and enter sensitive structures such as nose muscles, tendons or blood vessels. How to handle puncture wounds and control bleeding from puncture wounds. Apply direct pressure and seek further medical attention. Puncture wounds may carry germs deep within a wound and may result in serious infections. Therefore, any serious puncture wound should be evaluated by a professional as soon as possible. Leave impaled objects in place. It is important to understand that the object may pinch or for blood vessel, and removal of the object may result in massive blood loss from an injured blood vessels. Stabilize impaled objects with gauze and dressings and transport the individual to the emergency department. This concludes our lesson on punctures and impaled objects. Next we will review eye problems.